Hi everyone, my name is Lena, and in this video I'll be talking about my main video, which is healthcare systems around the world and health insurances. Now in this video I'll be talking about what are health insurances, the types of health insurances, as well as explaining what are the components that make up the health systems, and on the way I'll be comparing the health systems in Vietnam and in the United Kingdom. So without further ado, let's get started on our first part, which is the components that make up health systems around the world. Now, in the past few weeks, we have talked about health systems, the healthcare system, in which we've talked about the A&E services, the ambulance services, the A&E department, as well as pharmacies and pharmaceuticals and prescriptions. So basically, the components that make up the health system is the health workforce, which includes all individuals who work in the health sector, whether it could be physicians, doctors, nurses, surgeons, or even the ambulance driver called a healthcare worker. So that is the first component, is health workforce. The next component is services. So there are lots of services in the healthcare sector, and I will be naming a few. Firstly is the A&E department, which gives us ambulances, which has the service of ambulance and emergency care. Next is pharmacy, which has the service of administrating and giving out medications to the patient and giving some medical advice as well. There's also hospital care, health promotion, disease prevention, diagnosis, treatment, rehabilitation, specialist care, primary care. So those are some of the few services that we have in the health system, in a health system. So firstly, let's break down about health promotion and disease prevention. Basically, what this is that the hospital, that health system, will help to educate their patients on how to prevent a type of disease or a type of illness. For example, how to minimize the chance or the risk of having smallpox or chickenpox, things like that. And this focuses on keeping people healthy and preventing illnesses. This includes lifestyle initiatives, vaccinations, and health screenings. So that is health promotion and disease prevention. The next one is diagnosis and treatment. So basically what this is it involves identifying and addressing medical issues, illnesses, sicknesses that the patient have. This includes primary and specialist care, as well as services like pathology or imaging. So that is for diagnosis and treatment. Every health system has that primary care and specialist. So what is specialist and primary care? Specialist care is the service that has specific or complex health conditions, that deals with specific and complex health conditions, that needs a specialist in that field, not a general family doctor that needs to have a specialist. Pardon me. So for the specialist care, we have specialists in that field. For example, we have that surgeon, or we have that rehabilitator. So that is specialist care. That can include cancer treatment, health care, mental health care, or palliative care. That is for the specialist care. As for primary care, on the other hand, those are the services that are often a person's first point of contact with the health system, including general practice and dispensing medicines. So that could include a family doctor, a general doctor when you go for a checkup. That is primary care. That is the difference between specialist and primary care. Other services may include dental care, pharmaceutical care, like I said before, in the pharmacy, maternal and child health services, substance abuse treatment, nutritional support, and home care. So there are many types of services in the health sector, and I can't talk all about them in just one video because there are too much. Next, we'll compare the health systems in Vietnam and in the UK. Now, I'm going to be focusing on 5 main parts, which is funding, access, structure, quality, and technology. So those are the 5 main aspects that I'm going to compare in both countries. So for Vietnam, for the funding and in the UK, Vietnam is a mix of public, private, and patient out-of-pocket payments. While in the UK, we have tax-funded and free at any point of use. So that is the difference between funding in Vietnam and UK. As for access, Vietnam varies. It is variable. It is based on the patient's ability to pay for that treatment. As for the UK, the access is universal and it is based on their medical needs. So that is for the UK and Vietnam. As for the structure of the health system, the structure in Vietnam is a multi-level public network with a growing private options. That is for Vietnam. It has multi-level options, multi-level network. As for UK, it has a single centrally managed public system, which is the NHS. If you have heard about it before, it's that single centrally managed public system in the UK. As for the quality, Vietnam, it varies widely on the hospital. It depends on public hospital or private hospital, and also, but most of the time, central hospitals are often crowded. That is for the case in Vietnam. As for the UK, the quality is high standard and it has been developed over the past few years. Lastly, for the technology, Vietnam, its technology is modernizing, but there are still some occasions where we might have to use some old and some older equipment. And yeah, that is for Vietnam. As for the UK, the technology is advanced. They are advanced medical technology that are implemented in the health services and health systems of the UK. And so that is the comparison between the health system in Vietnam and in the UK. Moving on to the next part, I'm going to talk about what are health insurances. Well, health insurances is a contract that pays for medical expenses due to illness or injury. In exchange for a regular premium payment, an insurance company agrees to cover costs such as doctor visits, hospital stays, medications, and surgeries, protecting you from high unexpected medical bills. Health insurance can also help cover cost of the routine checkups and preventative services, which can lower your healthcare costs as well. So I read that about the dictionary meaning of what is a health insurances. So basically, what a health insurances mean is that you give money to that, you give monthly payments to that company, that insurance company, and when something happens to you, like an accident happens to you, then you won't be hit with a sudden large amount of money for that treatment. So let's say, for example, every month you have little small amounts that you pay to the company, the insurance company. But then when you have an accident, when you are sick and go to the hospital, and then your medical bill comes in, there is a large amount of the bill. So when you apply that insurances, when you have that health insurance, that insurance will be decreased because the insurance company has covered that for you. So that is basically what a health insurance is. There are different types of health insurances. There's the individual, the family, and the group health insurances, and it also depends on the patients as well. They want the health insurance to be high or to be low, and things like that. As for the type that it covers, the amount of the individual that it covers, it could be individual health insurances, which covers only one person and covers all the medical bills, the hospital stays, the doctor visits, and medication surgeries. That is for the individual. As for the family, it covers the entire family, the spouse, the children, people like that, under a single policy. So it applies for all members of the entire family. and it works under a single policy. As for the group, it is either provided by an employer or an organization to its employees, members, and its employees or members. That is the group health insurances. Other types of health insurances may include critical illness insurance. So critical illness insurance is basically when you have a serious type of illness, such as cancer or a type of disease that is life-threatening, such as a heart attack or a stroke. That insurance will cover that critical illness treatment. For example, you need to go into surgery, it will cover that amount of the bill. As for the second one is senior citizen health insurances. This is specifically designed for seniors. So elderly people is the target for this type of insurance. There's also maternity health insurance, which is the insurance that is for mothers, soon-to-be mothers, or it is related to child and birth, things like that. And finally is the top-up health insurance. So as you can see, there are lots and lots of different types of health insurances, and that depends on the patient needs. So be careful and also beware and choose carefully when you are choosing your health insurance. That is for what is the health insurances. I've covered about the insurances and health systems. For the second DE, I'll be talking about the importance of health services, of health insurances. Why is the health insurances important? And yeah, that is for the topic for my second DE. That also wraps up the end of my main video. If you have any other questions or any other comments you want to have feedback on my video, then I would be glad to hear. Thank you for listening to my video, and I hope to see you soon. Goodbye!